The biography of Professor Harden M. Askenasy, pioneering neurosurgeon of the Middle East, 1908 to 1975. Contributions by Karen Askenasy Taub, Manuel Duhovny, Anyekashi Ibe, and Aaron Morency. Read by Natural Reader Voice Synthesizer. The legacy of Professor Askenasy lingers on in the form of new generations of Israeli excellence in medicine and the astounding reputation that Israeli neurosurgeons have gained around the world. To this day, Israeli neurosurgeons are sought by leading teaching and medical centers across the world, thanks to the foundation laid by Professor Askenasy and others of his generation. Despite hardships, they rose from the ashes of the Holocaust, have fought endless wars, and suffered lingering traumas for the right of the Jewish people to thrive in the Promised Land, Eretz, Israel. He, along with his predecessors and successors, gave all they could to build sound foundations in every aspect of life, especially in the fields of cutting-edge science and medicine. Chapter 1. Early life. Harden Mihail Askenasy was born on July 31, 1908 in Bucharest, Romania, and died on July 19, 1975 in Petach Tikva, Israel. He was the son of Mihail Askenasy the father, who was a merchant Jew, and Bukane Libovasi the mother, who was an art teacher. He had only one sibling, a younger brother named Henry Askenasy. Harden was married to Nina Sussman for 31 years. He has one daughter, Karen Askenasy Taub, and two grandchildren, Dana Benziman, born February 9, 1982, and Tom Mihail Harden Taub, born September 8, 1989. During his early years, Harden attended a Christian primary school, which was particularly known for its quality of education. As a teenager, he attended the Real Gymnasium de Evangeliscan Gemi Idzia Bucharest, from which he graduated in 1926. After his graduation in Romania, he traveled to Languedoc-Roussillon region south of France to the University of Montpellier, an old medieval university recognized for its school of medicine, theology, Hebrew, and law, as well as the acceptance of all students of different Mediterranean religions. He decided to pursue his dream of becoming a medical doctor in the best places possible and embarked on science studies at the University of Montpellier. He obtained a certificate d'études physiques, chimiques et naturelles. After Montpellier, he continued on to the University of Paris, where he received his Diplôme de Docteur de Médecine in 1934. His medical thesis focused on endocrinology, familial myxedema. From September 1933 to October 1937, he worked on his neurosurgical residency at the Hôpital de la Pitié, Paris, France. He had the luxury of training under the direction of the famous Professor Clovis Vincent. Professor Vincent was a former disciple of Joseph Babinski, one of the founding fathers of French and international neurology. Together, Vincent and Askenasy operated on the well-known music composer, Joseph Maurice Ravel. Some of the other constituents who worked alongside Harden during his residency were Marcel David, B. Puech, Jean Talirac, and Gerard Guyot. All were heralded as neurosurgical leaders throughout France and the world for their scientific contributions. Count Thierry de Martel, a well-known general surgeon and neurosurgeon, also served as a staff member to Askenasy in the early 1930s. In 1933, Auguste Moniz visited Paris to present his new technique of cerebral angiography and worked side by side with Harden while he performed a dissection of the carotid artery in the neck. Moniz eventually received the Nobel Prize in Medicine in 1949 for his contributions to neurological science. During his training, Dr. Askenasy used sulfuramides followed by delayed performance of trephine puncture of the cystic lesion and evacuation of brain abscesses. This therapy avoided the need of an early surgical procedure to remove infected areas of the brain. It was the first minimal invasive surgical therapy technique used to treat brain abscesses and replaced the need for craniotomies to treat acute cerebritis. Sulfonamides revolutionized brain abscess therapy, and since have been replaced with modern antibiotics. Professor Vincent and David Askenasy described the association of brain tumors with psychiatric disorder. They also described the relationship between vascular lesion, hemangioblastoma, brainstem lesions ataxia and asteriognosis. The interrelationship of the nuclei stem in the cerebellum was also described. He contributed and analyzed the physiological effects of cerebral ventricle function and reported the association of the meningioma and cyst with the cerebral neighborhood. After the completion of his neurosurgical training, Professor Clovis Vincent wrote the following recommendation letter for Askenasy. The English translation from the original letter written in French reads, I, the undersigned Dr. Clovis Vincent, doctor at the hospitals of Paris, head of the neurosurgery service at the Hospital de la Pitié, hereby certify that Dr. Harden Askenasy, Bucharest, has been my assistant from March 20, 1934 to date. He has acquired technical knowledge, which allows him to perform neurosurgical surgeries. He was distinguished in his steadiness and regularity and his professional high consciousness. After being educated by some of the world's foremost physicians, Askenasy relished his years in Paris. He loved the city and had a large circle of friends, most with which he remained in close contact throughout the years. He enjoyed everything Paris had to offer in the 1930s, scientific studies and intellectual challenges of all sorts, culture, art, and of course, good food. He admired the two stars of the day, Josephine Baker, a well-known African-American singer living in Paris, and the French actress and singer Jean Bourgeois, better known as La Mistinguett. He left to the United States to continue his studies at Johns Hopkins Hospital, Baltimore under the tutelage of Walter E. Dandy, one of the most prominent precursors of modern neurosurgery in the United States. Professor Barnes Woodall from Duke University and a student of Professor Dandy, referred to Askenasy as one of the neurosurgical Foreign Legion Fellows learning under this prestigious forefather of American neurosurgery. Professor German Dickman of Argentina, his roommate at Johns Hopkins, recalled the fun the two young doctors had during their residency. Indeed, he always tried to combine work and good times with good friends. During the following year, Askenasy had the opportunity to travel around the United States and Canada, visiting and working in several important neurosurgery centers such as the LaHaye Clinic, Boston, with Gilbert Horax, W. Adson at Mayo Clinic, Rochester, University of Illinois at Chicago, with Paul Busey, University of Chicago, with Percival Bailey, McGill University, Montreal, Canada, with Wilder Penfield, and University of Michigan, Ann Arbor, with Max M. Pete. He had the opportunity to meet Harvey Cushing, a pioneer and the father of American neurosurgery, at his home in Boston a few months before he died. Cushing was upset with him because he did not know how to play cricket. He wanted Askenasy to participate in the game when he visited his home in Boston. Askenasy always spoke fondly of this meeting with one of the founding fathers of modern neurosurgery. During his training with Walter Dandy, Askenasy learned trigeminal nerve vascular decompression at the exit of the brain stem. After discussing with Charles Fraser, Askenasy became convinced that section of the Gasserian ganglion was a better technique than vascular decompression itself because the pain relief was quicker and longer lasting. Chapter 2. Return to Romania. Before the beginning of the Second World War in 1939, Dr. Askenasy returned to Romania to be with his mother and brother who were still living in Bucharest. The following is a recommendation letter from Professor Vincent written in Paris, on July 22, 1938. The English translation from the original version in French reads, "My dear friend, name unknown, I heard from Askenasy about your nomination for the position of George Marinescu. I am very happy for you. This is the result of patient, conscious and fruitful work. Marinescu can sleep in peace in his grave, with a successor like you. I am also very happy that you are going to realize what must be realized in all neurological clinics, meaning, the organization of the neurosurgery service. Askenasy contributes the greatest service. He knows his profession, which he had studied with us and has brought to perfection in America. But the most important is that he thinks neurologically during his surgeries. I will add that he is extremely conscientious. Yours cordially and with best memories." In 1939, he arrived in Romania and took a position as a neurosurgeon at the Caritas Hospital in Bucharest. Life soon became difficult and dangerous as World War II broke out on September 1, 1939. Anti-Semitism, including the infamous Iron Guard, was already rampant throughout Romania. Hatred of the Jews was taking on more sinister forms. There was widespread persecution that included dismissing Jews from their jobs, non-hiring of Jews, and beatings and public hangings. In one horrific incident, several Jews were rounded up, taken to the butcher house and hung on hooks from their jaws like cattle. There was no escape from the atrocities surrounding him. One morning, upon arrival to work at the Caritas Hospital in Bucharest, he was not allowed to enter into the hospital and he found his belongings and surgical instruments thrown out to the hospital's garden by the pro-Nazi sympathizers. He had no choice but to perform an emergency surgery to a deteriorating patient. The Jewish child had a benign lesion of the foreventricle extending to the medulla. The surgery was successfully performed in the garden and the patient later immigrated to Israel and successfully reached adulthood. In 1940 the pro-Nazi regime in Romania, Iron Guard, sent him to exile from Bucharest, together with hundreds of thousands of Romanian Jews, to Transnistria on the Ukrainian border. They were sent there to die of disease and hunger. While they were in the camp, Askenasy was obligated to clean the extremely dirty community bathrooms, latrines. After a difficult life in the concentration camp, he refused to talk to anyone about Transnistria, with the exception of Mr. V. Friedman, a Romanian Auschwitz Holocaust survivor who worked with him as a neurosurgical technician for 27 years at Bilanțin Hospital. Professor Askenasy was deeply traumatized by what he went through during this period and it greatly influenced his life and opinions. In 1943, Dr. Askenasy returned to the neurological department at the Hospital of the Red Cross in Bucharest because of the need for a neurologist neurosurgeon. He also belonged to the mobile medical unit of the Red Cross in North Romania. During his activities with the mobile unit, he was scheduled to perform an elevation of a depressed cranial fracture on a child. The surgical procedure and postoperative course went well and the child returned home. The family brought a large piece of bread for the medical team that saved the child's life, but after they became aware that the doctor was a Jew, they requested the bread be returned to them. A group of men then attacked him and beat him unconscious. During 1944, Dr. Askenasy took on another job, training young Jewish nurses. The young girls were teenagers who were thrown out of all school studies and activities because they were Jewish and could not learn any professions other than nursing or sewing. One of the students was 17-year-old Nina Sussman. The beautiful, leggy blonde captured the heart of the now 36-year-old surgeon and they embarked on a hot affair. A short time later Nina asked him to marry her, but the happy gentleman declined, professing that he was not yet ready to settle down. Upon rejection Nina married one of her many suitors, also a doctor, named Greenspan, that very week much to the dismay and horror of her parents. 1 week after the wedding loud knocks were heard at the Sussmans' apartment door after midnight. The family awoke, trembling in fear. At that time there was only one possibility for banging on doors in the middle of the night, the Gestapo. Nina's father Adolf went to the front door and reluctantly pulled it open. Askenasy stood at the door wearing his pajamas under a trench coat. Nina's father stared at him in amazement. "I came to ask you for your daughter's hand in marriage," he said. "Ah," said Mr. Sussman, "you're a touch late, Nina got married last week." "I know," Askenasy replied, "but I'd like her to get a divorce and marry me." "Hey, Harden," yelled Nina from the top of the stairs, "sure, I'll divorce." That she did and the couple got married. Askenasy always remembered the bombing of Bucharest by the mighty United States Air Force. He recalled that the entire sky over Bucharest was dark with the airplanes and the citizens would run trying to find a place to hide and protect themselves. In 1946, after World War II, he returned to his interrupted academic endeavors. Together with Dr. O. Sager, he published an article on physiological decerebrate rigidity. Chapter 3. Departure to Israel. After World War II ended, the couple and their families had to endure the harsh communist regime, although anything was better than before. However, they were Zionists, and after the horrors of the Holocaust emerged, along with their collective experiences during the war, they decided that the only place for them was Palestine, the historical land of the Jewish people. There, he and his wife Nina felt that they would not be persecuted and could live freely, even though Palestine was still under British mandate. Askenasy's father, Mihail, had died in the 1930s. His younger brother Henry had also studied medicine in Paris but never graduated. Instead, he returned to Romania and married into a Sephardic Jewish family who had escaped from Spain during General F. Franco's rule. This side of the family decided that 2 world wars in Europe were enough and immigrated to Argentina rather than face new challenges and hardship in Palestine. Buka, his mother, soon followed after not finding her place in Palestine. While living in Romania, Askenasy and his wife decided to leave for British Mandate of Palestine Eretz Israel. On Christmas Eve 1947, when Jewish citizens were selected to leave Romania, Harden and Nina's name were never on the list. This was because he was a precious asset to the post-war government due to his medical expertise. He went to his friend and former childhood classmate, Interior Minister of Romania, Tihari Georgescu, who was attending Christmas Mass with Romania's King Michael. In order to plead for a permit to leave Romania, Georgescu said, "Harden, why do you want to go there? There is war and there will never be peace in the Middle East. Here, we, the communist regime, will provide you with everything, a new house and the best opportunities." Harden answered, "I want to be in my own country." Georgescu then called his secretary to bring in a slip of paper with permission for them, and he signed it. Harden and his wife Nina, together with Harden's mother and Nina's parents, were very happy to obtain their freedom at last. They departed Romania by boat on the Pan-York and Pan Crescent. Also on the boat was Dr. Eugene Herzberger and his wife Magda. The Pan-York and Pan Crescent boat was acquired in the United States from the United Fruit Company by Danny Skind, head of the Mossad El Aliyabet's ship procurement project in 1947. The pans were both 360 feet long, 4,570 ton, and were capable of carrying up to 7,500 passengers each. The pans were not qualified to be registered under United States flag legally. Skind created a dummy company and made Paul Schulman the president of the company FB Shippings, and they were able to register the pans under the Panama Maritime Flag of Confidence. Haganah Jewish paramilitary organization helped organized refugees all over Europe to be transported back to British Mandate Palestine. Due to the British sabotage, the Pan Crescent developed engine problem and was sent to Venice, Italy for repairs. Then the ships would first stop in Constanza, Romania for the installation of 7,500 sleeping shelves on both pans before departing to Burgas, a Bulgarian port in the Black Sea. Aboard the Pan-York, Dr. Askenasy was able to smuggle his neurosurgical instruments. After departing from Burgas, Bulgaria, the British Royal Navy diverted the ships to Famagusta, Cyprus on January 2, 1948. The almost 15,000 refugees on both pans were taken to the British interim camp Karalos refugee camp. This diversion came in an effort to comply with the British Royal Navy blockade to Palestine. Harden and Nina were held by the British Army in order to comply with the immigrant quota to enter Palestine. The British policy was to avoid any Jewish immigration into Palestine at all costs. An excerpt from Raquella Levy, Ruth Gruber, and Magda Herzberger. Immigration must be stopped at all cost, lest men of military age from the camps and Cyprus enter Palestine and join the Haganah forces to fight the Arabs. Even in the quota system of the first in, first out, the British barred all able-bodied men from leaving the camps. In all of the Middle East there is not one brain surgeon. How many head wounds, how many damaged brains, how many lives could he be saving? Instead, he is here, waiting. One night while in the Famagusta refugee camp, a member of the Haganah organization came to invite Dr. Askenasy to attend an important meeting about him. He was granted a British entry certificate to Palestine under the name of Mr. Jacob and Mrs. Rivka Schwartz, who gave up their British entry certificate to Palestine so that Harden and Nina could leave. After the anguish of German Nazi behavior during the World War II and the infamous British blockade, Dr. Askenasy arrived under another name and started a new life in the Promised Land, Eretz Israel, with his wife. His valued neurosurgical instruments made it safely to British Mandate of Palestine Eretz Israel, thanks to the help of a Haganah member by the name of Josh Leibner, who smuggled them past British officers aboard the ship. These instruments were important and highly appreciated by the medical community, as there were few available at that time in British Mandate of Palestine Eretz Israel, and they were pivotal in educating neurosurgical specialists in the future state of Israel. Years later, he donated the instruments to Beilinson Hospital. After World War II, England had an organized, anarchy and premeditate chaos event, in order to destroy all Jewish institutions and promote tension amongst them and the Arab community. Deception and also delay of procrastination and misinformation were common factors of post-World War II on the British Mandate over Jerusalem. Chapter 4. The Last Days of English Palestine Mandate and the Birth of Israel. In Palestine, he was in the Monopole Hotel in Tel Aviv, a hotel that belonged to one of Nina's first cousins. Upon arrival, he was offered a job as a physician in Harden Hospital in Afula. He was then recruited by Dr. Harden M for Beilinson Hospital in Petah Tikva and Asuta Hospital in Tel Aviv for his private patients at the very moment they established a specific unit for neurosurgery. He arrived in Israel 2 years after the departure of the only available neurosurgeon at the time. In December 25, 1941, Dr. Henry Wigderson, formerly of the New York Montefiore Medical Center, arrived in Wilhelma Airport near the suburb of Lod, later changed to RAF Station Lydda in 1943, but currently known as Ben Gurion International Airport. He began working 6 days later after traveling thousands of miles, from the western United States to the Far East, in an effort to avoid the ongoing war in Europe. Dr. Wigderson, an American neurosurgeon, was at Hebrew University in Jerusalem at Mount Scopus Hospital, who received economic support from the Hadassah Women's Organization. In Palestine, he recruited his assistant Dr. Aaron Beller, a general surgeon. However, in 1945 Dr. Wigderson left Palestine and returned to the United States of America due to a medical family emergency. Dr. Beller left Israel for the United States of America, as well, at the end of World War II, but eventually would return during the Independence War after the Mount Scopus Massacre, Jerusalem, Israel, on May 13, 1948. Dr. Herzberger joined Professor Askenasy in 1949 after he was in the Israeli Defense Force, taking the place of Dr. Kobergodo, his first assistant. According to Dr. Albert Bartel, from 1949 to 1950 he could not find any neurosurgical department in Jerusalem. Dr. Abek Moran, Bartel Personal Communication. Dr. Beller was operating in a former English mission hospital in central Jerusalem but later served as head of the neurosurgical unit at the Hadassah Hospital in Jerusalem and retired in 1980. Chapter 5, Beilinson Hospital, Kibbutz Holim. Beilinson Hospital was founded in 1936 by Dr. Moshe Beilinson, as a private hospital with 40 beds. This hospital further developed to become one of the main hospitals within the Kibbutz Holim Klar Lead Health Service organization in Petah Tikva. Beilinson later became a large medical center and today is known as Rabin Medical Center. Soon after arriving in Palestine, Dr. Askenasy accepted the offer to work at Beilinson Hospital in Petah Tikva on March 24, 1948. For the next 27 years, he would work as a neurosurgeon under the Kibbutz Holim Klar Lead Health Service organization, providing the best modern neurosurgery in all of its subspecialties, i.e., traumatic brain and spinal cord injury, congenital malformations, infection, movement disorders, spine, cerebrovascular disorder, brain and spinal cord neoplasty, Parkinson disease, endocrinology, and psychosurgery. Dr. Askenasy began working at Beilinson Hospital in the Department of Surgery in the original building. He was allowed to perform diagnostic and surgical procedures at Beilinson Hospital. Allocated specifically to him were 5 beds in the surgical department and 5 beds within the internal medicine department. 1 year after his arrival, a floor was added to the old building due to growth of the neurosurgical patient load. The original doctors at Beilinson were of German Jewish background, many of them having escaped the brutal Nazi regime in Germany during the 1930s. The doctors in this group included Dr. Seldinger, radiology, Dr. Nathan, general surgery, Dr. Wynn, anesthesia, Dr. Casper, pathology, Dr. Lewidus, internal medicine, and Dr. Gans, gynecology/obstetrician. During this period, the Israeli army sent all of the tough head injuries and auto accident victims to Askenasy. Wherever he went, the police officers and the taxi drivers recognized his vehicle and would send him back to the hospital if there was an emergency. Dr. Bzazinski, head of obstetrics at Hadassah Hospital in Jerusalem, made the statement in her book Raquella, A Woman of Israel by Ruth Gruber that, he's, Dr. Askenasy, already training other surgeons in neurology, highlighting his rapid success as a neurosurgeon in Israel. Mr. Amnon Ben Yehuda was a former Israeli soldier of the Palmach during the pre-independence war, was injured in the northern front near the border of Lebanon. After being injured, he was evacuated to the newly opened neurosurgical care unit at Beilinson Hospital. Mr. Amnon Ben Yehuda survived his severe head injury, but his commander and 27 other soldiers were killed in battle. 63 years later, the following personal communication was given by Mr. Amnon Ben Yehuda, regarding his experience with the doctor at Beilinson Hospital. Any friend of the Askenasy family is my friend. I was either the first or one of the first soldiers operated on by Professor Askenasy, may he rest in peace, at Beilinson. I was wounded in April of 1948 in Galilee by a shot to the left side of the skull and finally reached the hospital 60 hours later. I was in a coma for 8 days. I was operated on Friday, April 23, 1948, Erev Pesach, Passover. Professor Askenasy removed a 10x10 cm part of the left skull and only gave me a 5% chance of survival. Upon waking up from coma, my mind was clear, but I could not speak and my vision was limited. I was extremely weak and the right side of my body was paralyzed. Finally, I was released from the hospital after 17 days. I also want to add that during the rehab year, I used to see Dr. Askenasy from time to time and he also asked me several times to appear at lectures he was giving, as a living example. We developed a very special bond. He was like a second father to me. In fact, he was responsible for me choosing to go to UC Berkeley for academic studies, rather than do it in Israel. He recognized that I needed to get away from the war trauma, something my own father and I were unaware of. Dr. Askenasy actually convinced my father to do it for me. This is my brief medical history with Professor Askenasy. He was a noble person, totally professional, and a caring and wonderful human being. He was not just a doctor to me, he was like a second father. His face was the first thing I remember seeing once I regained vision, and he was so handsome, exuding confidence. Mr. Emnam Yehuda donated a significant contribution to the Pal Mach Museum in Ramat Aviv in remembrance of Dr. Askenasy, who saved his life. Mr. Emnam Yehuda, Personal Communication. Another interesting case during this period was an English soldier who suffered a traumatic head injury. Appearing deceased, he was immediately placed in the hospital's morgue. The following morning, a janitor saw some movement of the cadaver and Dr. Askenasy was called to see it. He found the patient still alive and he immediately operated on him to remove a depressed fracture, saving his life. For the next 20 years, the British soldier returned to Israel to see the man who saved his life and have dinner with him every Christmas. He continuously thanked him for saving his life. Chapter 6, Neurosurgical Department. In 1950, Dr. Askenasy became head of the Department of Neurosurgery in Beilinson Hospital's new building. This new department would accommodate the large increase in the number of patients, and it included two sections, one for 25 males and another for 25 women and children, and if needed the departmental corridor of the hospital is used. The sheer volume of his work can be understood from the following newspapers publications: Al-Hamishmar newspaper, September 20, 1948, dozens saved from certain death. Dozens of wounded soldiers were saved from certain death thanks to the newly opened neurosurgical department opened at one of our hospitals. 130 brain surgeries were performed until now, surgeries which were only available in London or Stockholm hospitals. Davar newspaper, October 8, 1952. The 1000th neurosurgical operation performed at Beilinson Hospital. The department, headed by Professor Askenasy, has reached its 1000th brain surgery this week. Over 2,000 patients were treated in that department since its opening in April of 1948. There were different foreign neurosurgeons visiting Israel to spend some time. Dr. Herzberger remembers Professor Leo Davidoff from Montefiore Hospital, New York, United States came and stayed in the department for more than 2 weeks to work in numerous neurosurgical specialties. When necessary, the pediatric department would also host neurosurgical cases. Today, the Beilinson Hospital has been renamed as Rabin Medical Center, which is affiliated with the Sackler School of Medicine and has incorporated Dina School of Nursing, Geha Psychiatric Hospital, Schneider Children's Medical Center of Israel, Helen Schneider Women's Hospital, Felsenstein Medical Research Center, and a host of other health and surgical departments. During the next decade, he was very busy taking care of injured soldiers and civil casualties that brought into the hospital. This was due to the mass violence caused by the Palestine Fathayin militia in the War of Independence and the Sinai-Suez Canal War of 1956, in addition to the everyday cases of tumors, injuries, road accidents, and the whole spectrum of neurological problems. Subsequently, Dr. Askenasy's department also treated wounded soldiers and Jewish and Arab civilians in the Six-Day War in 1967, and the Yom Kippur War of 1973. He was a strong believer in neuroradiological diagnostic techniques from the beginning of his residency in Paris. For him, neuroradiological studies were an important aspect of his neurosurgical career. Such studies were performed by members of the Department of Neurosurgery, and included cerebral angiography, myelograms, pneumoencephalography, ventriculography, and ultrasonic study. According to Herzberger and A. Bartel, in 1949 the cerebral angiography was performed with neck dissection on the carotid artery, but 2 years later it was done percutaneously. With the advent of such techniques, many clinically misdiagnosed patients were finally able to undergo neuroradiological and nuclear medicine studies. Multiple sclerosis is a disease that was frequently misdiagnosed clinically in early days of neurosurgery. Many cases that had been classified under the condition were later confirmed as foramen magnum meningiomas or other pathologies. Patients that were suffering from thoracic scoliosis now understood that the disease was the result of a spinal meningioma. Performing myelograms helped in the diagnosis of cranial and spine junction as well as spinal cord tumor, spinal metastasis, or lumbar disc. After his visit to Professor Leksell in Sweden, he introduced the ultrasound encephalography of any intracranial pathology that produced shift of the midline structure in the brain or the detection of hydrocephalus, as well as the detection of brain tumor. He attended weekly neuroradiology meetings to discuss patients that were undergoing any form of neuroradiological studies on diagnosis and vertebral after treatment of embolization of stainless steel bulb. These meetings included members of both neurologists and neurosurgeons, Professor Bernard Bornstein, a neurologist, Dr. Sashana Matz, a neuroradiologist, and Dr. E. Lubin, nuclear medicine, along with other residents from respective departments. Dr. Askanasy's comments, criticisms, and recommendations were helpful in improving the diagnosis and treatment of many patients. He conducted medical rounds with all members of the department and personally evaluated every patient admitted to the service. Every evening, he requested that the staff on call or the deputy chief of the department provide him with information regarding the status of the operated patients and what had occurred during the day. He was very particular about maintaining a clean operating field to ensure safety and success. His technique of convexity meningioma removal was frequently removed in one piece without significant bleeding. During the late 1950s, Professor Askenasy was the first neurosurgeon in Israel to perform a clipping of a cerebral anterior communicating artery aneurysm using an early self-closing aneurysm clip with A. Bartel, A. Beck Moram, Bartel, personal communication. Previously, the department used the current technique as silver clip, Oliver Krona clip, Silverstone clamp, and neck ligature. Dr. Bartel was sent to Traugott Reichert's department in Freiburg, Germany by Professor Askenasy 1958 to go and learn the use of stereotactic unit for the treatment of Parkinson disease, which took him 2 weeks to learn and acquire the complexity of the mathematics of the Traugott Reichert's stereotactic system. However, the best of his surgical abilities were demonstrated with the performance of cerebral hemispherectomy in a teenager with uncontrollable seizure disorder. The surgery was successful and the patient's epileptic seizures were controlled. During his surgeries, he used all different shapes and sizes of cottonoid patties, especially during convexity meningioma removal, transphenoidal stereotactic frame for endocrinological disorder or hormonal tumor dependent. Leksell stereotactic placement isotope implantation for brain tumor therapy. He also operated over 500 cases of Parkinson disease and extrapyramidal disorder. He was an excellent teacher and most of his residents achieved international academic recognition after they left Beilinson Hospital. He had a very good relationship with the nursing staff at Beilinson Hospital, as they supported his expertise. Yael Shavit served as the first head nurse in the neurosurgical department. The department would later include Ms. Fira Ankari, Devora Vishinsky, as head nurse and Ruth Gavat, and Shoshona Rubna, were their assistant. They all served with Professor Askenasy at the neurosurgical department at Bilansen. Together, the nurses kept the department well organized and provided quality, nursing care. Farah Ankari, an elder amongst the nurses, had a close working relationship with Professor Askenasy and frequently provided him with advice and support. A few months before the opening of the neurosurgical intensive care unit, a well-balanced teaching program for new nurse candidate positions was organized. Mr. V. Friedman was a valuable neurosurgical technician and member of the neurosurgical department who assisted the doctor in all activities, including surgeries, interventional neuroradiology, equipment development, as well as physiological examination during trigeminal neuralgia procedures. Mr. Friedman reports that during many trigeminal neuralgia procedures he needed to sit in front of the patient under the operating drape and check the facial reaction to pain on the distribution of the trigeminal nerve during the Fraser-Gasserian ganglion section. His knowledge and wisdom were of a great help to the young trainees. He worked with Dr. Askenasy for 27 years from 1948 to 1975. In 1968, the first neurosurgical intensive care unit in Israel was added to the Department of Neurosurgery with the collaboration of Dr. Manuel Duhovny and neurosurgical nurses. Dr. Moshe Soroka, Chairman and Chief Administrator of Kupat Holim Klarlit, provided financing for the new intensive care unit building and Bilansen Hospital. Dr. Koren, the medical director at the engineering department, immediately began work on the unit. The goal of the neurosurgical intensive care unit was to raise the standard and scope of care. The Department of Neurosurgery had been very active in the area of traumatic brain injuries due to the war, terrorism, and motor vehicle accidents, so there was a need for such a unit. After the death of Professor Askenasy, the intensive care unit was renamed to Professor Askenasy Intensive Care Unit. Within the Department of Neurosurgery at Bilansen, another section of neuro-ophthalmology was created by Dr. Ryrie Manor. Professor Askenasy had the opportunity to work with many leaders in neurosurgery during his tenure, overall contributing to his status as a successful neurosurgeon. In 1964, he traveled to Oxford, England to visit Professor J. Pennybacker to observe his neurosurgical techniques. He also worked along with Professor Herbert Olive Krona, heralded as the best European neurosurgeon during this period. Askenasy also visited Professor Lars Leksell in Karolinska University Hospital, Stockholm, Sweden, where he learned the stereotactic procedure for Parkinson's disease. He was impressed for the quality of care and respect from the elderly chairman of the service, Professor Herbert Olive Krona, and Gosta Norlin, who participated on the neurosurgical department patient care, and while both of them were retired, they still had their own office and secretary assistant provided to them by the hospital. The use of Leksell frame was simple to use than the previous attempt with the Reichert frame. The latest had a complicated mathematical preparation of the stereotactic target. Upon his return to Bilansen Hospital, more than 500 cases of Parkinson's and extrapyramidal disorder surgeries were performed. The Leksell stereotactic technique was also used for intractable pain control and radioactive seed implantation. He was fluent in Romanian, French, Latin, German, English, and also understood Spanish and Italian. Upon his arrival to Israel, he learned Hebrew at the age of 40. This was particularly difficult because of his many medical obligations during the War of Independence, as he was working almost non-stop with little time to study. 60 years later, Mr. V. Friedman still remembers when patients would complain about their ailments and he would have to write them in German for him to understand. When new applicants joined the program, he advised them not to worry about not being able to understand the Hebrew language, giving the example of how he, too, arrived in 1948 and didn't understand a word. With time, he became proficient in Hebrew and could be heard and understood very well. He was frequently a guest on radio shows in which he had to speak in Hebrew, such as the Kol Israel interview in which he commented on an emergency landing, with which he was involved in Ankara, Turkey. He was also interviewed on television about brain death confirmation, selection of donors for heart transplant and the use of seat belts in traffic accidents. When Senator Robert Kennedy was assassinated, a radio station asked him to participate in an interview about head injury. He once participated in a movie as a medical advisor directing the Israeli Defense Forces on battlefield head injuries and also in another movie on treatment of Parkinson's disease with stereotactic surgery. Harden was a good friend and medical advisor of Ben-Gurion, the first Prime Minister of Israel. He treated patients from surrounding countries, such as Iran, Turkey, Greece, Cyprus, England, Kenya, Ghana, and Switzerland. He always extended his services wherever they were needed. In the early 1950s, Askenasy was given permission from the Kibbutz Holim organization to also work privately at the Asuda Hospital in Tel Aviv, maintaining higher standards than were required of the staff at Asuda by taking his nurses and assistants from Beilinson to all of the private surgeries. He felt he had the best and most professional team at Beilinson, but made sure they only came when their work at Beilinson was complete. He was invited to Turkey by Turkish physicians to come and examine Isaac Altabev, who was the former Jewish member of Turkish parliament suffering from cerebral vascular thrombosis in 1962. Professor Askenasy was a neurosurgical pioneer in the Middle East. He was a teacher, researcher, and responsible for making the Israel Neurosurgical Society a member of the European Association Neurosurgery, EANS, and the World Federation of Neurosurgical Society, WFNS. He was a patriot, loved his country, the State of Israel, and absolutely loved his profession. Not to mention, he was very generous and donated to Beilinson Hospital twice, while he personally donated his own surgical instruments once to the facility. He also donated $2,500 United States dollars to purchase surgical instrument as well. These funds were his own pay received after treating a child, Rami Katz, who was injured in a car accident in Ghana. He was urgently sent to Ghana by the Israeli government, treated the injured boy and returned with his young patient on board the plane to Israel for further care. In 1959, $2,500 was a huge sum and it served to buy much needed surgical instrument for the department. It is this selflessness which gave the hospital the opportunity to open its neurosurgical department. Chapter 7. Research Endeavors. In collaboration with the Weizmann Institute of Science, Rehovot, Israel, Professor Askenasy played a major role in the research and development of the transphenoidal hypophysectomy stereotactic frame that used radioisotopes implant to treat endocrinological disease, acromegaly, hyperthyroid, diabetes, cancer, pain control, as well as endocrinological dependent tumor, breast cancer, prostatic cancer, and thyroid cancer. The equipment was developed to prevent the complication of freehand insertion and to perform hypophysectomy using a minimally invasive procedure, depending on the radioisotope implanted, yttrium, iridium, gold. This equipment improved the accuracy of isotope placement within the hypophysis, avoiding the need of a craniotomy. Fluoroborate ions labeled with fluorine 18 and 131 iodine ingestion for the detection of brain tumor, also analyzing the injection of the technetium-99 and neohydrin mercury, Ag. 197, and the comparison with another technique like electroencephalogram, e.g., echoencephalogram, skull X-ray. INPTA, intravascular, for the detection of giant aneurysms, stereotactic pain therapy for intractable cancer pain, and the use of radioactive iodine 131 serum albumin early diagnosis of subclinical hydrocephalus in newborns with myelomeningocele or encephalocele. First non-invasive intracranial aneurysm, the 113 minutes scanning for visualizing and evaluating giant intracranial aneurysms postoperatively. He also collaborated with Professor Isaac Kaplan, a plastic surgeon, in 1972 and extensively researched the interaction between the CO2 laser and brain tissue. This known interaction served for further analyses and development of the 100-watt CO2 laser for the removal of brain tumors. In collaboration with Professor Barrick Bloom, Professor Askenasy researched lateral hypothalamus stimulation for induction of myocardium infarction and its reversal with oxytocin. He also studied the outcome of low-level radiation on the development of intracranial meningioma along the scalp to search for parasites, ringworms, in the heads of Jewish immigrants on their way to Palestine in the early 1920s TO 1930. It was discovered that application of low-level radiation led to the formation of secondary tumors. Extrapyramidal symptom, Parkinson diseases, associated with intracranial convexity meningioma compressing cortical area 6. The diagnosis of normotensive hydrocephalus by radioiodine serum albumin, RISA, and neuroleptanalgesia in carotid artery ligation by Wynn in 1966. In early 1960s, Professor Askenasy, together with Professor Ephraim Free from the Weizmann Institute of Science, developed a magnetic catheter, POD, for intra-arterial endovascular navigation to brain circulation. Several arterial aneurysms were injected with iron particles to induce intravascular thrombosis. This approach was an early development for endovascular therapy and treatment of cerebral arterial aneurysms thrombosis. This catheter system was copied and reproduced by an engineer who originally worked within the Weizmann Institute of Science, but later immigrated to the United States, settling at a prestigious university. This research led to the development of the new specialty in radiology, endovascular catheterization, as well as cerebral artery coil, selected catheterization of anterior venous malformation embolization, cerebral artery suction of the thrombi in case of cerebral vascular accident. The concept of this technique was shown by Isaac Asimov fiction Fantastic Voyage. Today the industry is looking for more therapeutic ways to improve this innovation. Lately Siemens developed a neurological unit with a magnetic property to mobilize the endovascular catheter. Also Gaston et al. Used the external magnetic field to catheterize the brain artery. Chapter 8. Academic achievements. Askenasy was a professor of anatomy and studied the nervous system at the College for Jewish Students, in Bucharest in 1940. In Israel, he began teaching students in 1950 and officially became a professor of neurosurgery at the Hebrew University in Jerusalem in 1959. He also became a professor of neurosurgery at Tel Aviv University in 1963. Dr. Askenasy was rewarded as a permanent member of the Tel Aviv University Senate in 1964. Most of the training that he received was of a high academic degree, being allocated at several universities in Israel or the United States. He was a thesis advisor to several medical students, including David Ryman, who completed the evaluation and diagnostic technique for the detection of brain tumor in neurosurgery, Ehud Sternberg on giant cerebral aneurysms, Benny Klein who completed his on glossopharyngeal neuralgia, and Sarah Shalit on traumatic lesion of the optic nerve. There are several early residents that served him but went their various ways after the Israel Independence War. Dr. Herzberger joined Professor Askenasy as a resident in 1949 after serving in the Israel Defense Force, and after his graduation in 1953 as a neurosurgeon, Dr. Herzberger developed a new department of neurosurgery at Tel HaShomer Hospital upon request of Dr. Haim Sheba. The hospital was originally a British military camp used for paraplegic rehabilitation center for the British soldiers during the Second World War. It is now known as Sheba Medical Center named after the founding director Harden M. Sheba established in 1948. Many of the residents within the Department of Neurosurgery at Beilinson chose alternative routes after their arrival. In 1948, Dr. Kavrigaro, general practitioner, who was his first resident, resigned from the neurosurgical program. Dr. Albert Beck Moran, Bartle, was originally interested in internal medicine but was unable to complete a residency in the department due to a lack of space. He eventually became a resident of Askenasy within the Department of Neurosurgery. Dr. Beck Moran, Bartle, would later become the first deputy chief at Beilinson Hospital in 1955, head of neurosurgery at Love Hospital, Tel Aviv, as well as professor of neurosurgery at the Tel Aviv University. In 1953, Dr. Yehuda Kozaravitsky, Kozari, became a resident in Askenasy's department. After completion of his training, he later became the chief of neurosurgery at Tel HaShomer Hospital in 1963, replacing Dr. Herzberger, who departed to the United States in 1957. During the time in between, there were two neurosurgeons, who filled the position, Dr. M. Adams and Dr. Briss. In 1953, Dr. A. Gross from Romania became a resident of the department for 1 year and then left. In the mid-1950s, Dr. Jacob Israeli and Ezra Toledo joined the department. The group worked on different cases performed in the medical proceeding in Beilinson Hospital, such as cervical treatment of herniated disc, orbital angiography, cerebral arteriovenous malformation, staphylococcal epidural, orbitofrontal injury, suppurative metastatic abscesses, intracranial space-occupying lesions, positron localization intracranial tumors. Due to the busy schedules, there was no basic science research conducted during this period. They barely had time for their family, but after all the hard work they gained an insurmountable experience that carried them through their future endeavors. In 1964, Dr. Israeli became deputy chief and worked with Professor Askenasy until he retired. In the 70s, he became the associate professor of neurosurgery at Tel Aviv University. In the early period, from the medical point of view, everything was intense. The development of new service and the new group being very active had new doctors arriving from overseas. A new wave of residents from South America then started and included, Manuel Duhovny later, Professor of Neurosurgery at the University of Illinois at Chicago, Wayne State University and Associate Professor at University Pittsburgh, Head Neurosurgery at Oakland VA Hospital in Pittsburgh, Director of Neurosurgical Laboratory, Professor of Neurosurgery at Cordoba National University, Honorary Professor at Tashkent University in Uzbekistan, and Vice Chairman of the Department of Neurosurgery at Henry Ford Hospital in Detroit, Michigan. Ricardo Siegel, after completion of his residency, he traveled to the Children's Hospital in Chicago and had a fellowship under the direction of Professor Anthony Raimondi and a fellowship at the University of Pittsburgh under the direction of Professor P. Janetta and M. Duhovny. After his fellowship, he became Associate Professor of Neurosurgery at the University of Pittsburgh and Chief of Neurosurgery at Oakland VA Hospital after the departure of Professor Duhovny. Staff of the Department of Neurosurgery at Hadassah Hebrew University Medical Center, Felix Umansky. After his completion of his residency in Israel, he became a fellow in Massachusetts General Hospital in Boston under the direction of Professor William Sweet. In 1982, he moved to complete his fellowship at Henry Ford Hospital, Detroit, Michigan under the direction of Professor J. I. Ausman and M. Duhovny. Then after his fellowship he became professor and chairman of the Department of Neurosurgery at Hadassah at the Hebrew University in Jerusalem, and Ehud Arbit, professor at Cornell University Medical College, chief of neurosurgery at Sloan Kettering, New York. Another resident, Albert Hefitz, started in neurosurgery but moved to psychiatrics, becoming a professor of psychiatry at Haifa University, and Chaim Karni, who eventually pursued neuro-ophthalmology. Several neurosurgeons started at Bilanson but they transferred to another center in the country, such as Dr. I. Gruszkiewicz from Poland, who moved to Rambam Hospital in Haifa, George Wanine from Morocco, France, who moved to Love Hospital in Tel Aviv, Dr. Schechter, who moved to Rambam Hospital in Haifa, and Dr. Heilbronn, who moved to Love Hospital in Tel Aviv. We can therefore safely say that Professor Askenasy has laid the foundation for a new generation of young Israeli neurosurgeons who have achieved the top of their profession both in Israel and abroad. Chapter 9. Harden and his family. Dr. Askenasy dreamed of a new life in the new land after the War of Independence. There was finally time for the many immigrants and Holocaust survivors to settle down. Now they could try to build a new life, beginning a normal routine in the newly born Jewish state of Israel. Harden and Nina left the room they lived in the nurses' quarters at Bilanson Hospital, which they shared with Nina's parents and Harden's mother, and bought a small apartment in Tel Aviv. The couple, who by now were enjoying a rich social and cultural life and an ever-growing circle of friends, moved to a larger apartment with an adjoining clinic in 1956. They were ready to start a family. One of Harden and Nina's greatest joys was the arrival of their only daughter, Karen, who was born in 1957. Both Nina and Harden loved traveling and often took their daughter Karen with them. Harden and Karen loved trying all different types of food and trying new experiences. Nina, however, did not indulge in that passion and preferred to spend time with her family. The couple's large circle of friends included people from all walks of life, and both had a very large group of friends in Paris, including Harden's colleagues from medical school as well as a large group of Romanians who had immigrated to France before and after the war. These immigrants included many of the couple's childhood friends, and the couple always felt at home in Paris, traveling there frequently. Both Harden and Nina had a reputation of being the best dressed, Harden in his quiet elegance and Nina with her fashionable know-how, which perfectly matched her tall and slender figure. Harden had a very good relationship with his mother-in-law, who he called Mama and reputedly loved more than his own mother. Together, with Nina's mother and Karin, the family was small, but very close and full of love. Harden M. Askenasy died of bladder cancer in 1975 when he was only 67 years old. He left behind shocked family and friends. As his wife Nina remarked sarcastically, he didn't spend £1 from his future pension, which left it very cheap for the medical institution. He was known for his hard work, and actually worked until he could no longer stand on his 2 feet. Unfortunately, Nina died from a brain tumor 16 years later, at the exact same age. This, in the eyes of their daughter Karin, was a cruel twist of fate. 41 years after his passing, Karin states, "Time does not heal, it just intensifies the sense of loss. I don't think I ever met such a generous person, both to his family and his patients. I can tell you that very often, in the evening, after having finished his private consultations, he had very little money to give to my mother and said, 'Oh, this old couple, I just couldn't charge them, and those parents with the baby from Beersheba? I could see they couldn't afford it and this baby was so critically ill. I just couldn't take money from them.' This I remember vividly. Many times before a special or complicated surgery, he would wake up at night, or, rather, not go to sleep, and pace around, re-examining X-rays, consulting books and researches, drawing plans for the operation, and sometimes, if I woke up myself, I would join him in the kitchen for a snack behind my sleeping mother's back. This was a special treat and very special moments for me, which I cherish as a memory of love. He just could not sleep before complicated surgeries. I can tell you that he lived for his profession and was very passionate about it. Today Karin, a copywriter and doula, non-medical midwife, is married to Benjamin Taub, born in 1941. He is the son of a bank owner from Lodz, Poland, who managed to miraculously escape with his wife to Palestine just 1 month after the German invasion of Poland and after being held/detained at the Gestapo headquarters in Lodz. Benjamin was born on Mount Scopus in Jerusalem and studied pharmacology at the Hebrew University in Jerusalem. He was a captain in the Israel Defense Forces Medical Corps, and has worked at Teva Pharmaceutical Industries as chief purchasing manager for many years. Karin has 2 children, Dana Benziman, from her first marriage to Eli Benziman, and Tom Yael Harden Taub, the son of her current husband of 27 years. Dana was born on February 9, 1982, and is an ABA therapist who works with children across the autistic spectrum. She is now beginning her master's degree in behavioral sciences at the Tel Aviv University, where her late grandfather served as a member of the Senate and founded the neurosurgical department. Tom was born on September 8, 1989, and his middle name is Harden, after his late grandfather. He finished his 3 years compulsory military service in the Israeli Air Force, as a member of the ground crew at the Nevatim